Hello, everybody. For those of you who are not aware, my name is Tanner Lapointe, and I am a program facilitator with the Schizophrenia Society of New Brunswick. Today, we're going to be talking about a very complex and devastating illness called borderline personality disorder. What exactly is borderline personality disorder? Borderline personality disorder is a very complex and serious mental health issue. It can be characterized by the inability to control one's emotions as well as severe mood swings. So what exactly are some of the symptoms of borderline personality disorder? There are 9 symptoms and traits commonly associated with BPD. Let's talk about them. So the 9 traits of borderline personality disorder. Intense, rapidly shifting moods. Oftentimes, borderline personality disorder is confused with bipolar disorder because of the mood swings. Unlike bipolar disorder, however, BPD involves rapidly shifting moods. For example, they might be very angry 1 minute, and then the next hour be very happy, and then the next hour be very sad. The mood swings are more frequent. Intense and inappropriate anger. Unstable self-image and low self-esteem. Chronic feelings of emptiness. A pathological fear of abandonment. Pattern of unstable relationships. These do not necessarily have to be intimate relationships. They can be relationship with friends or relationship with bosses or colleagues at work. Self-destructive behavior, such as being promiscuous or engaging in substance abuse or criminal activity. Suicidal ideations and actions, and sometimes even symptoms of psychosis, such as delusional thinking and hallucinations. So these are the 9 traits commonly associated with borderline personality disorder. So what exactly causes borderline personality disorder? Like most disorders, there is no one specific cause we can point to. However, there are certain factors that may contribute. These factors fall into 2 major categories: biological factors and environmental factors. Let's go over some of them. So the biological factors: a genetic predisposition, which is a family history. So somebody in your family was at BPD. Studies show that you are 5 times as likely to develop BPD if there is a close family member who has had the disorder. And differences in brain structures. People with borderline personality disorder typically have differences in brain structures, such as portions of the brain that control impulses. So the environmental factors: being abandoned or emotionally neglected as a child. This is one of the most common things reported by people who have borderline personality disorder. Experiencing trauma and abuse, such as sexual abuse or physical abuse. So how exactly is borderline personality disorder treated? It is probably one of the most complex and difficult disorders to treat. Let's go over some of the treatment methodologies. Medications are often used in the treatment of borderline personality disorder. It is noteworthy, however, that there is no specific medication used to treat borderline personality disorder. There are certain medications that may help to mitigate some of the symptoms. Some medications that may be used include antidepressants, anti-anxieties, antipsychotics, and mood stabilizers. One psychosocial intervention that may be used in the treatment of borderline personality disorder is called dialectical behavioral therapy. Dialectical behavioral therapy works by using the concept of mindfulness and helping the individual understand certain situations and their behaviors. It also helps the individual mitigate and manage self-destructive behavior. Another form of psychosocial treatment that may be used is called cognitive behavioral therapy. Cognitive behavioral therapy works to help the individual change the way they think, feel, and act. I would like to thank you all for taking the time to watch this video today. I hope it was very helpful and informative. For your benefit, in the description I have included some contact numbers if you are seeking help. Please remember, however, if you are in crisis, call 911 or proceed to your nearest emergency department as soon as possible. I have also included links to various websites if you are seeking for more information about these topics. Thank you all. Remember, recovery is expected.